we're living through a very unprecedented time where I think fundamentally how we work, how we live is being changed profoundly. And one of the things obviously we are learning a lot from is digital infrastructure and its role in what's happening. In fact, I would say, we will go through three phases broadly. There is the response phase, in which we are acting as digital first responders to all the other first responders. There is the recovery phase. We're in the midst of this, talking about what does back to work look like. And of course, there is the reimagine phase, because I don't think we go forward with exactly the same type of workflows or how we did work or business process the same way. So if you sort of say digital infrastructure, any way you look at it, is going to play a pretty profound role. In fact, if there is any silver lining, even on looking back at our own history as an industry, I feel the resilience of the economy and the society during this very unprecedented time is thanks to sort of some of the modern architectures of things like the public cloud or the SaaS services. I mean, when I look at what was possible for an educational institution or a company to go remote and use Teams at scale with all the elasticity, wouldn't have been possible without sort of the architecture of Office 365 or Microsoft 365. Well, same thing for a hospital to be able to provision all of the telemedicine capacity without Azure. So I think that's good. One of the core priorities for Microsoft, I always go back, is in a world where software is going to shape pretty much every industry, whether it's healthcare, whether it's retail, whether it's education, public sector, then the most important thing is let's make software developers very productive. I would say the most important thing that we've heard is resilience, right? I mean, if you sort of say, what's the top priority for any organization and all of the professionals that are trying to create business continuity for that organization? How do you keep their employees safe and yet at the same time retain levels of economic activity that are possible? Given the current situation. That's what is become a top priority for them. And that means us as a partner showing up and working alongside them to create that resilience. It's going to be Teams, 75 million daily active users of Teams. The key is it's just not video, right? So the idea of Teams is that I can be on video, I can simultaneously be editing a Word document with you, I can be doing workflow on a business process with you, we can be chatting. That ability to reimagine how people come together to collaborate, to work during the meeting and after the meeting and before the meeting. That's what I think will unlock a lot of productivity during even this remote phase and also when we come back to work phase. There's going to be a tremendous amount of competition. There was competition before, there's going to be competition going forward. And all of us, as you said, rightfully, we have to innovate and differentiate, and customers will choose and developers will choose where the opportunity is. Yeah, I mean, we are. In fact, we are studying. I think this is one of the things where this at-scale experiment that we are doing, I think we now I encourage our own teams is to, one, let's get all the data, let's publish the data, but let us not claim too early that these are long-term trends. Because I think we need to be able to sort of really study what does it mean for productivity even. For example, quite frankly, there are some statistics around productivity right now, especially around GitHub and how we use even GitHub internally, the check-ins, the pull requests, and you look at them and say, wow, people are more productive. But at the same time, you got to balance out what does that mean then with mental health. And you need to be able to have long-term metrics because productivity is not something that is measured in isolation. It's measured in the context of overall well-being of people and economies and societies. So I think we're going to learn a lot. I think what we are going to come out of this, at least for my practical, even in my own leadership team, is being more mindful. So we said, oh, wow, let's actually connect. And make sure that what is really how you're feeling, what are you anxious about, what are you really worried about, let's make sure that we are aware of that. Because I think that awareness is there as leaders of our organization and of our co-workers. How do you recreate that mechanism? I think it requires a new type of culture even. there isn't a monolithic way that Microsoft works. Game studios work differently, developer, products work differently, our kernel team works differently. And so therefore, I think we're going to accommodate for more and more flexibility. If anything, what this shows is let's be even less monolithic and accommodate for a variety of different workflows and work styles and accommodate for it versus being dogmatic. I mean, hospital infrastructure, the resilience of it, telemedicine, remote learning, these were all long-term forces. But if you think about the acceleration, how are teachers, students, administrators learning in education on how to make outcomes around education with remote learning more productive. I mean, we'll learn a lot out of this phase. Same thing with telemedicine. We've talked about these for decades, but this is the time where we are now doing it at scale. And so the question is, what are we learning? What does it show which is sustainable? What should we reimagine when we get back, quote unquote, to normal? Because telemedicine as triage. I mean, one fascinating example is even in the COVID crisis, we've learned a lot about, for example, we don't want to overburden the healthcare system. So you need this AI triage. So we have this health bot we built, which is being used by hundreds of hospitals around the world in their own applications as the first level of triage. But after the first level of triage, you do need to sort of have a workflow that chains to a telemedicine consult, and from there to testing. So that ability to build a holistic solution was all done within multiple weeks, not years. And now that it's built, I'm sure it'll get used even in a normal, like I would sort of first go to a health bot that triages me, then takes me to an emergency consult, and that then asks me whether to come into a hospital as an outpatient, whether to wait for a test kit. I think these are workflows that are going to be relevant much beyond COVID as well.